Imagine waking up tomorrow morning and seeing your blood pressure numbers exactly where your doctor wants them to be. No pounding heartbeat after breakfast, no dizziness when you stand up too quickly, no waking up 3 times during the night to rush to the bathroom, no wondering whether your medication has stopped working. Just smooth, steady blood pressure control because your medication is finally getting the chance to work the way it was designed to. That isn't wishful thinking. After more than 20 years of helping adults manage hypertension, heart disease, and healthy aging, I've discovered something surprising. Many people believe their blood pressure medication simply isn't strong enough. Others assume they need another prescription, a stricter diet, or more exercise. But in reality, countless patients are unknowingly making small mistakes that interfere with medications they already take every single day. I'm Dr. Kevin, and today I want to show you 5 medication mistakes that I repeatedly see among adults trying their best to control hypertension. These aren't careless mistakes. They happen because nobody takes the time to explain them. They aren't usually written clearly on pharmacy labels. They often aren't discussed during appointments. And unfortunately, they can mean the difference between good blood pressure control and numbers that remain frustratingly unpredictable. By the end of this video, you'll understand how your medication actually works, what it needs from you to perform properly, and one overlooked factor near the end that could completely change the timing of your treatment plan. Let's begin with something millions of people do every morning without thinking twice. You wake up, you swallow your blood pressure pill, then you head straight for the coffee machine. For many people, this routine feels perfectly normal. In fact, it feels responsible. You're taking your medication exactly as prescribed and enjoying your usual morning coffee.
In fact, it feels responsible.
But if your medication belongs to a group called beta
exactly as
blockers, that cup of coffee may be quietly working against you. Beta blockers lower blood pressure by slowing the heart and reducing how forcefully it pumps blood. They help the cardiovascular system remain calmer and under less strain. Caffeine does nearly the opposite. Coffee stimulates the nervous system. It can temporarily increase heart rate, raise blood pressure, and make the heart beat more forcefully. Imagine 2 people trying to steer the same car at the same time. One person wants to slow down, the other wants to speed up. That is essentially what happens when caffeine enters your bloodstream shortly after taking certain beta blockers. Some people notice fluttering sensations in their chest. Others feel mild palpitations. Some describe feeling anxious or unusually aware of their heartbeat. Many simply assume this is normal morning behavior. But sometimes it's not. It's your medication trying to calm the heart while caffeine arrives and encourages it to work harder. Fortunately, the solution is surprisingly simple. Give your medication a head start. Take your pill with a full glass of water. Get dressed. Make your bed. Read the news. Feed the dog. Do your normal morning routine. Then enjoy your coffee about 45 minutes later. This small adjustment gives the medication enough time to begin circulating before caffeine enters the picture. And coffee isn't the only concern. Strong tea, energy drinks, caffeinated sodas, and certain pre-workout supplements may create a similar problem. The question I'd like you to consider is this. How many years have you been taking your morning blood pressure pill and drinking coffee right afterward without anyone ever mentioning this possibility? And believe it or not, the next mistake surprises even more people because it involves something sitting inside kitchens all over America that most people consider one of the healthiest breakfast choices imaginable. The second mistake catches many people completely off guard because it doesn't involve another medication. It isn't a supplement. It isn't alcohol. In fact, it's something often advertised as a healthy breakfast choice: grapefruit. Now, let me be very clear. This warning isn't about oranges. It isn't about lemons, limes, or most citrus fruits. The concern is grapefruit specifically, and in some cases, Seville oranges used in certain marmalades. After more than 20 years helping adults manage hypertension and cardiovascular risk, I've learned that this interaction surprises almost everyone the first time they hear about it. Inside grapefruit are naturally occurring compounds that interfere with an enzyme in the intestinal wall responsible for processing several medications, including a group called calcium channel blockers. Drugs such as amlodipine, felodipine, and nifedipine may be affected. Think of this enzyme as a traffic controller. Its job is to help regulate how quickly medication enters circulation. When grapefruit blocks that traffic controller, medication can accumulate in the bloodstream at higher levels than originally intended. You haven't changed your prescription. You haven't taken an extra tablet. But your body may behave as if you've taken significantly more medication. For some people, this may lead to excessive blood pressure lowering, dizziness when standing up, feeling unusually weak, lightheadedness. In severe cases, fainting may occur. What makes grapefruit especially tricky is that its effect doesn't disappear after a few hours. The enzyme can remain partially blocked for 1 to 3 days. That means drinking grapefruit juice tonight may influence how tomorrow's medication behaves. Spacing it out doesn't reliably solve the problem. The safest strategy for people taking affected medications is usually complete avoidance, but always confirm with your pharmacist or physician whether your specific prescription falls into this category. Now, let's move to mistake number 3. This one affects thousands of older adults every year, and unfortunately, many only recognize the problem after an injury occurs. We're talking about water pills. Doctors call them diuretics. These medications help the kidneys remove excess sodium and fluid, reducing the amount of volume circulating inside blood vessels. Less fluid generally means less pressure pushing against artery walls. The medication works exactly as intended. The problem often comes down to timing. Imagine taking a diuretic after dinner or shortly before bed. Your kidneys don't suddenly go to sleep. They continue responding to the medication, which means your body may begin eliminating fluid right in the middle of the night. Perhaps at 1:30 a.m., then again at 3 a.m., maybe once more before sunrise. For younger adults, this may simply feel annoying. But for someone in their 60s, 70s, or 80s, it can become something much more serious. At night, blood pressure naturally tends to be lower. You wake up abruptly. You sit up quickly, stand up, walk through a dark hallway. Your circulation hasn't fully adjusted to the sudden change in position. Blood pressure temporarily falls even further. Doctors call this orthostatic hypotension. The result? Dizziness, loss of balance, a stumble, or sometimes a devastating fall. After many years discussing fall prevention with patients, I can tell you that hip fractures are not minor injuries. Many older adults require surgery, rehabilitation, months of recovery. Some never completely regain their previous level of independence. And in certain situations, the chain of events began with nothing more than a blood pressure medication taken at the wrong time of day. Fortunately, the solution is often straightforward. Most people benefit from taking diuretics early in the day, ideally in the morning. This allows the medication to do its work while you're awake, active, and fully alert. However, don't change your medication schedule on your own. Instead, ask your doctor a simple question. Is there any medical reason I shouldn't take this medication earlier in the day? For many people, the answer may open the door to better sleep, fewer nighttime trips to the bathroom, and a significantly lower risk of dangerous falls. And coming up next is a mistake that almost everyone considers logical at first: missing a pill, then taking 2 to make up for it. Unfortunately, that's where serious problems can begin. The fourth mistake usually comes from good intentions. You wake up in the afternoon and suddenly realize something frustrating. You forgot to take your blood pressure pill that morning. Almost immediately, a thought enters your mind. I'll just take 2 pills tomorrow. Or maybe you think, I'll take both doses now and catch up. After more than 20 years of helping adults manage hypertension, I've learned that this reaction is incredibly common. It also happens to be one of the most dangerous mistakes patients can make. The logic seems reasonable. If 1 pill lowers blood pressure, 2 should simply make up for the one you missed. But blood pressure medications don't work like missed appointments. These medications are carefully designed around timing, absorption, and predictable effects on your cardiovascular system. When you suddenly double the amount, you're not extending protection over 2 time periods. You're concentrating it into one. And for some individuals, especially older adults, that can produce a dramatic drop in blood pressure. People may suddenly feel weak, sweaty, nauseated, lightheaded. Some even faint. If this happens while driving, walking downstairs, or standing in the shower, the consequences can be severe. The safer approach is surprisingly simple. Read the instructions that came with your medication. Most blood pressure medications provide guidance about missed doses. In many cases, if you remember within a few hours, you can still take the medication. But if it's already close to your next scheduled dose, doctors often recommend simply skipping the forgotten pill and returning to your normal routine. One missed dose rarely causes a major problem. A double dose, however, can. And if forgetting medication happens frequently, don't blame yourself. Talk to your healthcare provider. There may be longer-acting medications, reminder systems, or alternative dosing schedules that fit your lifestyle better. Now we arrive at mistake number 5. And honestly, this may be the most fascinating topic we've discussed today. Because it isn't really a mistake, it's a question. A question about timing. Let me ask you something. When do you think your blood pressure is most dangerous? Most people answer immediately. During the day, at work, in traffic, during stressful meetings, after drinking coffee, after exercise. Those answers make sense, but physiology tells a slightly different story. While you're asleep, blood pressure naturally falls. The body enters recovery mode. Heart rate slows, stress hormones decline. But then, before sunrise, something remarkable happens. Hormones such as cortisol begin increasing. The nervous system becomes more active. The body prepares itself for waking, and blood pressure rises rapidly. Cardiologists call this phenomenon the morning blood pressure surge. For some people, blood pressure may rise 30, 40, or even 50 points within just a few hours. And unfortunately, this surge coincides with one of the most vulnerable periods for the cardiovascular system. Research has shown that heart attacks and strokes occur disproportionately during the early morning hours, often between 6 o'clock and noon. Here's where things become interesting. Most people don't take their medication until after waking up. The medication then needs time to dissolve, be absorbed, circulate, and reach therapeutic levels, which means your blood pressure may already be climbing before your medication has fully started working. This observation led researchers to investigate an approach called chronotherapy. Chronotherapy simply means matching medication timing with the body's biological rhythms. Several studies have suggested that, for some patients, taking certain blood pressure medications at bedtime may provide better protection during those vulnerable early morning hours. But, and this is extremely important, that does not mean everyone should suddenly switch to nighttime dosing. Some individuals experience blood pressure patterns that behave differently. Certain patients don't experience the normal nighttime dip at all. Others actually have higher blood pressure while sleeping. For these individuals, bedtime medication may not always be the best choice. That's why I encourage patients to ask one simple question during their next appointment. Is my medication schedule optimized for my blood pressure pattern? And while you're there, ask another question. Have I ever been evaluated for sleep apnea? Because sleep apnea is one of the most overlooked causes of difficult-to-control hypertension. Loud snoring, morning headaches, feeling exhausted despite sleeping all night, being told you stop breathing while sleeping. These symptoms matter. Treating sleep apnea often improves blood pressure significantly, sometimes more than adding another medication ever could. At the beginning of today's discussion, I promised one important message. Here it is. Medication doesn't work in isolation. It works inside a living system. Your sleep, your eating habits, your caffeine intake, your body clock, your breathing patterns, all influence how well that medication performs. So after watching this video, I want you to do 3 things. First, identify which of these 5 mistakes may apply to you. Second, write down one question you want to ask your doctor about medication timing. And third, consider whether sleep quality deserves a closer look. Because sometimes better blood pressure control doesn't require another prescription. It simply requires giving your current prescription the environment it was designed to succeed in. And that conversation alone may protect your heart more than you ever imagined.